Hello everyone, this is Dr. Pugh from Pathology Department, School of Medicine, IMU. Today we will discuss on inflammatory mediators. The inflammatory mediators are the substances that initiate and regulate the inflammatory reactions. Mediators may be produced locally by the cells at the site of inflammation or may be derived from circulating inactive precursors that are activated at the site of inflammation. There are two types of mediators, cell-derived mediators and plasma-derived mediators. Cell-derived mediators are produced from leukocytes, including neutrophils, leukocytes, monocytes, eosinophils, and basophils. Moreover, other cells such as macrophage, mast cells, platelets, and endothelial cells. Plasma-derived mediators are produced in liver and circulating in the plasma. So first of all, we will discuss on histamine, which are the vasoactive amines and which are the first mediators to be released during the inflammation. The source of histamines are mast cells, basophils, platelets, and endothelial cells. It is stored in granules and it's released by degranulation response to a variety of stimuli. Histamine can cause vasodilatation, increased vascular permeability, and endothelial activation. Antihistamine drugs are commonly used to treat some inflammatory reactions such as allergies. The next one is serotonin, which is preformed vasoactive mediators present in platelet and certain neuroendocrine cells. The importance of this action in inflammation is still unclear. The next one is prostaglandins. They are the lipid mediators produced from arachidonic acid. Prostaglandins are produced by mast cells, leukocytes, platelets, and endothelial cells. There are several subtypes of prostaglandin and each subtype produces the different actions such as vasodilation, vasoconstriction, increased vascular permeability, chemotaxis, leukocyte adhesion, and smooth muscle contraction. Analgesics, including aspirin and ibuprofen, block the prostaglandin synthesis and that's why they are used in treating pain and fever. The leukotrienes are also lipid mediators produced from arachidonic acid. They are produced in leukocytes and mast cells and are involved in vascular and smooth muscle retraction, and also they recruit the leukocytes. The other important mediators are the cytokines, which are secreted by many cell types including activated lymphocytes, macrophages, mast cells, endothelial cells. They mediate and regulate immune and inflammatory reactions. Cytokines have actions on endothelial activation locally, and their systemic action include fever, pain, anorexia, hypotension, and decreased vascular resistance. The details about the cytokines in inflammation will be discussed in another video. Chemokines are a family of small proteins which act primarily as chemoattractant for leukocytes. They are produced from leukocytes and macrophages. Although the role of chemokines in inflammation is well established, it is still difficult to develop chemokines antagonists because of their functional redundancy. The next one is platelet activating factor or PAF. They are a phospholipid-derived mediators. A variety of cell types including platelets itself, basophil, mast cells, neutrophils, macrophage, and endothelial cells can elaborate PAF. PAF causes vasodilation, increased vascular permeability, leukocyte adhesion, chemotaxis, degranulation, and oxidative bust. The plasma-derived mediators include complement and kinase. The complement proteins are a collection of soluble proteins and there are more than 20 complement proteins. Among them all, C5a, C3a, and C4a mainly play in inflammatory responses. Their actions include leukocyte chemotaxis activation and vasodilatation by the mast cell stimulation. Another plasma-derived mediator, kinase, causes increased vascular permeability, smooth muscle contraction, vasodilation, and pain. So today, we discuss a few mediators which are the most important for the acute inflammation. As you already know, the inflammation is very important in the eliminations of the pathogen and other cause of inflammation. However, the prolonged inflammatory process result in chronic diseases process and they may eventually result in organ failure or damage. Therefore, limiting the inflammatory process by the use of anti-inflammatory agents is important in controlling this process and limiting the cause. Thank you so much for watching this video.